have actually been instrumental in setting the International Organization of Integrated Health Practitioners, and there are practitioners from modern medicine, Western medicine I call it, and also it has yoga, Ayurveda, homeopathy, Tai Chi, Qigong, hypnotherapy, art therapy, music therapy, dance therapy, chiropractic, because all of these have got a science behind them. And now I'm confident that we can merge and combine these sciences so as to give the maximum benefit to the patient.
Welcome back to Raw. Today I'm doing things slightly differently because I have the most well-renowned professor joining me on Zoom. So we're going to see how this works. Professor Rajeev Gupta is a medically qualified doctor with 35 years experience in modern and Western medicine, but also a deep-rooted knowledge of many other disciplines of alternative and complementary medicine. He has devoted almost 10 years of his life to develop a joined-up approach of the systems of medicine so as to provide best healthcare to the patient. He's therefore called by many as the father of integrated medicine. He has written 35 books and over 60 scientific papers. He has chaired the Central Specialist Committee of the Royal College in the United Kingdom and Regional Council of the BMA, the British Medical Association. While holding such high positions, he still believes that the healthcare systems around the world face increasing challenges. Integrated model of healthcare offers a promising solution, one that emphasises prevention, patient empowerment, and the blending of science with ancient wisdom. Modern medicine cannot be discounted for the foreseeable future as the go-to medical care. However, there is no cure for every disease in modern medicine. Alternative and complementary medicine also have their own advantages and can be dovetailed with Professor Dr Rajeev Gupta has made enormous efforts over the past decade to have a scientific and combined approach rather than a combative or competitive approach. His legacy as the father of integrated medicine will endure as a testament to the transformative power of collaboration and innovation in the pursuit of better health for all. Dr. Gupta is widely recognised as the father of integrated medicine, a pioneering approach that seeks to blend the best of modern medicine, evidence-based, with the ancient wisdom of complementary and alternative therapies. With nearly 35 years of experience as a senior consultant in the NHS and extensive research into the scientific mechanisms of alternative medical practices, Dr. Gupta's vision of holistic healthcare has been instrumental in reshaping patient care, making him a renowned figure in the medical community. Today, I'm looking forward to welcoming Rajeev. Today, I welcome the father of the International Organization for Integrated Healthcare Professionals, Dr. Rajeev Gupta, who believes that combining and connecting together, we can get better healthcare for all. Welcome, Rajeev. Lovely to see you here today.
Thank you so much, Jane. It is amazing to see you. We have worked together on many aspects, and it's really good to have the synergy of thinking. I'm a modern medical practitioner, and you do the psychohypnotherapy, and it's good to see how we can bring it together. So let's see how it plans out today.
How our conversation plans out. Okay, so tell me a little bit about why you decided that you needed to connect to complementary and alternative medicine working alongside conventional NHS practice.
So I have been a modern medicine practitioner, qualified as a medical doctor, did my MD as post-graduation, and have done 30 years of experience after that, working in UK for almost 26 years now, and did practice in India before coming as assistant professor in the prime educational institution and regional institute. What I've realized over a period of time, modern medicine is very good for acute diseases. If you have heart attack, you're not going to be sitting and doing yoga or hypnotherapy, whatever. On the other hand, for chronic diseases or conditions, there is limitation of the treatment. Many conditions don't have any cure, or many conditions use the medicines, the Western medicine, for a period of time with side effects and cost implications and also some risks to the body. And I think a combination can be done using different tools like toolbox, and hence I have actually been instrumental in setting the International Organization of Integrated Health Practitioners, and there are practitioners from modern medicine, Western medicine I call it, and also it has yoga, Ayurveda, homeopathy, Tai Chi, Qigong, hypnotherapy, art therapy, music therapy, dance therapy, chiropractic, because all of these have got a science behind them.
Mm-hmm.
It's that science not discovered. So past 10 years or so, I've done a lot of work to dig in the scientific evidence. And now I'm confident that we can merge and combine these sciences so as to give the maximum benefit to the patient. Because at the end of the day, patient does not care what discipline or science. Patient wants relief.
Absolutely. Absolutely. I couldn't agree with you more. In fact, you're not the only person that believes about integrating and complementary medicine. For many, many years, people have been alluding to that. If you look at like Dr. Bruce Lipton, who understands the biochemical effects of brains and how they function, and actually shows in his research that cells in the body are affected by thoughts.
Yes, exactly. And that is why the problem has been that there has not been a lot of digging of the scientific evidence. And that in old time, if I think of 3,000 years ago, I've been reading literature, for example, for Ayurveda, which is one of the herbal methods. A lot of lifestyle medicine is incorporated into part, which we continue to practice. And the same is a lot of these herbs have been used. They are used in our day-to-day life, some kitchen herbs and other things. So there is a lot of that. The scientific evidence, why you use that herb, how it acts, does it act on which part of the body, what are the biochemical reaction, neurological reactions, neurobiology, neurochemistry, all these things have not been explicit or explored. Nowadays, as you know, everybody is evidence-based. They don't even buy anything from Amazon till they have seen like 60 reviews. So
absolutely.
It's important that we provide them the evidence. If they know this is how it goes, say for example, people want to know in diabetes, how does the insulin act or metformin act? And there is a plenty of literature there. So in the same way, if we provide for alternative medicine, this is the evidence, this is how it works. It works on mitochondria or it works on neurotransmitter. And the same neurotransmitter effect can we get that we get from the antidepressant, from psychotherapy or hypnotherapy or CBT. Then it's much safer, easier option without any side effect.
Side effects.
Start.
Yeah. I was actually only working with a client yesterday who is suffering terribly with her nerves and anxiety, and she was prescribed sertraline, which I think is a standard practice for anxiety and depression. The thing is, she wasn't depressed. She was just very nervous and very anxious after falling on numerous occasions. And then she's fearing going outside. So she was put on sertraline because of her nerves, but actually the root of that was the fear of leaving the property, leaving her house, going outside, leading a normal life. And then I wondered why that dosage was upped from I don't know 50 to 50 milligrams instead of 25 milligrams very quickly. It was interesting to see that, and the reaction that she got in her body was actually nerves, more nerves.
Yeah. I think one of the important things which a lot of people forget is that their current system, the way it has worked, is people are trained in one or the other. Yes. So people who are working on modern medicine, they're trained in modern, they're not taught anything of alternative and complementary medicine.
Yeah.
The people who work in X branch are taught that. So people who are becoming Ayurveda practitioners are taught Ayurveda. People who work in Chinese medicine are taught Chinese medicine.
Yeah.
So it's currently a disadvantaged system because they don't know enough about the other in order to have that confidence.
Yeah, we need to merge all the different techniques and different therapies to make almost like a bespoke practice for the individuals that we see in front of us.
Yes.
But that costs a lot of money.
Yeah,
and it takes a lot of time.
I think that is, in my view, future. Sorry, I just wanted to make that point. So I didn't want to interrupt you, but the real life is that there is change or shift in the thinking now. If you think of people who are at high intellect level or high net worth level, people who are like, big rich people, or people who are in a position where they can have a choice, they are keeping modern medicine as the baseline, but they are moving more toward natural methods of treatment. And this is so important that people who can afford, they are doing it. And therefore, people who can't afford, there are inhibitions in terms of the insurance claim, or say, for example, in the UK, NHS healthcare is free, and therefore they don't have that choice. If they want to go to seek practitioners in terms of homeopathy or chiropractic or hypnotherapist, a good proportion of the hospitals do not allow it. I am aware that some trusts have allowed marginally, particularly like in cancer or other things, some alternative or complementary therapy, but it is still a big problem for a majority of patients, and that is kind of an inhibitive factor or restrictive factor. So we should try and gather the evidence, and more evidence we provide, more confident they will feel in order to incorporate these therapies as part of the offer. And same is the NHS. As you know, currently there's very limited things, and it's modern medicine primarily all over because of the NICE guideline, because of the training of the doctors, the way they practiced. They are not taught. If they're not taught, they can't have a confidence, and then can't prescribe or even refer. So we are in a position, but there is more opening now. I am a medical doctor with modern medicine license, but I have studied, so I have a confidence, and I have given lectures at the national, international seminars, at least at 40 platforms, and they start believing now. So there is a group of modern medicine practitioners who believe that, yes, there is something beyond modern medicine that has got evidence base and that can be accepted. But I've written now quite a few books giving that scientific evidence so that people can read and understand that it's not airy-fairy, somebody's talk.
Yeah, there's evidence. There's evidence attached to everything that we do. And everything that I do is science backed. It's not woo woo. I think people think a lot of it's woo woo medicine, but actually there is a lot of science behind how emotional freedom technique works, for example, how hypnotherapy works, how mindfulness is playing a big part in shifting the way we think, how understanding our beliefs and values play a big part in moving us forward instead of staying us stuck or keeping us stuck, and how even the power of prayer can really to help us to understand ourselves, because I believe that sometimes we're looking in the wrong place. Sometimes, as Dr. Wayne Dyer said, sometimes we need to change the way we're looking at stuff in order for the things that we're looking at to change. And a lot of the problems stem from inside. They come from internal parts as opposed to external validation from social media or from Instagram or from the ChatGPT and AI approaches, even though some of those have benefits.
I mean, it's important point you have touched that the thinking has changed, but currently there is not a robust availability of these combined scientific approaches, which we are creating now on behalf of the International Organization of the Integrated Health Practitioner, IOIHP, and as a chair of the advisory board and the founder of the integrated medicine. Many people call me father of integrated medicine, partly because the 10 years worth of work, spending my own time, my own money, and even a huge amount of resources. Now we are in a position that we have a sound background, and we are creating courses for the people so that people can have a scientific understanding and access to that, instead of Uncle Google telling them what to do, Chat GPT telling them what to do, which may be right, may not be right, depending on what it is. And again, at times patients come to, I still work in hospital. Patient, oh, I've read in Google this, which may be completely wrong.
Yeah. So, as you work in the hospital, can you give any, obviously, the stories behind some of the things that you tell your patients to do alongside the conventional route? Do you give them any tips or hints? Is there anything that they can do for themselves to help them release feelings or emotions that are stuck?
So I'll come to that in a minute, but I probably it came to my mind while we were talking, and I think it will be good for the listeners to know that I presented a paper recently in IIT, which is Institute of Technology International Conference on Mind-Body Medicine, and it was on obesity and neuro-linguistic programming, because I use it in my practice. I do a weight management service which is commissioned by the NHS, but instead of using drugs, I do a lot of programming and then asking the questions, getting the right answer, motivational interviews, emotional intelligence, particularly the self-awareness and self-management. I'm kind of fully trained on EQI assessment and accreditation on that. And I've pulled these threads to put into my practice. And I ask people to do it on a regular basis. So the results I presented, which are published now through Sage Journal, where the scientific publications happen. So this is one area where I'm fairly confident that it happens. It's because everybody knows if you eat less and do more exercise, you will lose weight.
Yeah.
Obesity is rising, not going down. That is because we have a conscious mind and a subconscious or unconscious mind, and there is a disconnect.
Yeah.
Consciously, we know eating less and doing more exercise will bring the weight
Yeah,
down.
but the subconscious programming is telling us something different because the two are they're not compatible. They don't talk to each other. I always liken it actually to like your head is like an iPhone and your subconscious is like a Samsung, but the two don't speak to each other, so they're not compatible. And so you're trying to look for the answers here, but actually the answers are deep buried in the subconscious world. And often we can't change what's there unless we reprogram the narrative. And that takes a little bit of skill using techniques like neuro-linguistic programming and somatic therapies and emotional freedom techniques and hypnosis, because those are the criteria that can get into the subconscious pathways.
I mean, just exactly as you say, is that the emotional problems can only be tackled at that level.
Yeah.
Cannot be tackled at a cognitive or consciousness level.
Exactly.
Unfortunately, our eating is done by emotional brain, not by conscious brain.
Absolutely.
People come to me that, I have not eaten anything. And particularly the kids come there. And mom said that, yes, you decided not to eat all day. And at 10 o'clock you went and raided the fridge. Not even knowing, subconsciously, unconsciously, you go there and you watch. People are watching movie and they're eating like that. All stuff has gone in. They are not consciously aware of it.
Yeah, it's autopilot. It's the autopilot system. It's exactly the autopilot system. It's similar to when you first learn to drive a car, I think, and you're all fingers and thumbs with pedals and mirrors and trying to get your head around how you're going to move this vehicle. And then all of a sudden it just clicks and that's it. You forget actually the connection to how difficult that first movement of that vehicle actually is. But once it becomes habit, it just becomes into the autopilot system, and then we just do it automatically.
I mean, it's interesting that when I have compiled a lot of this work into a book, which hopefully will be released soon, which is
What's it called?
Healing Beyond Prescription.
What's it called?
Healing Beyond Prescriptions.
Healing Beyond Prescriptions. We look forward to that being published.
Because the whole idea is that, beyond medicine, you need to really have addressing these things.
Yeah.
And there are now even Stanford University has done a research, and this is on the functional connectivity targeted transactional and transcranial stimulation called SHIFT. And the way they have done is that your standard protocol stays, but then in a double-blind randomized controlled trial, particularly for conditions like fibromyalgia, for chronic brain disorder, if you use hypnosis as adjuvant, the results are better.
Yeah.
And partly because for fibromyalgia, there's no treatment. Fibromyalgia is a condition where you have pain, weakness, brain fog, not ability to do things, and you do all the blood tests, EEG, MRI, CT, all of the brain, everything. All tests are negative. So this is a problem which is related to the function of the body rather than to structure of the body.
Yeah, and the function of the body is I think is connected to the energy that we hold within us. And energy medicine really is here actually. Albert Einstein said that what did he say? That frequency was the next medicine. And energy medicine is frequencies. So things like Reiki and energy healing, like chakra balancing and the connection to somatics and how we understand the feelings that we have within our body can all be released, because your body doesn't really want to stay stuck. It has no intention of putting us in danger, really. It wants to heal. But if there's blockages in the line, in the functional track, then it needs the energy needs to be released that's blocked. And it's blocking for a reason. It's blocking as a protection, usually. It's protecting us from what the subconscious believes is further hurt, harm, or danger. But actually, it wants to get better and it wants to heal. It doesn't want to stay stuck.
Unfortunately, there are a lot of people who practice this therapy because there is no definite qualification needed and there is no regulation. Anybody doing 3 days course or 2 days course become energy therapists. They start doing things they do not understand the science behind it. They do not understand exactly what are the benefits and the risks. And that's what happens. People go, they do not get the benefit, at times get, irrational results and erratic outcomes because immature people doing it, partly because there were nothing else to do. Even I'm apologizing as some person who got redundant from the job thought, let me just do this energy therapy course and start earning money from it. And there is nothing to stop it.
Yeah.
And they actually are the people which causes a bad name to other therapies, as a result of which we get a knockback. And therefore, it has to be regulated. It needs to be done by people who are fully qualified.
Yeah, absolutely.
We have the course, Manisha, who actually has been doing the standard setting for these IOIHP courses. And the main emphasis is that we would only allow people to use the course if we deem them fit. And also, once they qualify, we would do a test so that we know. And they need to do a CPD, which is continuous professional development, in order to maintain the level of the knowledge and skills so that they are safe.
Yeah, absolutely. Absolutely. It should never be done in an unsafe way. But there still is many things that we can do to help ourselves.
And the problem is that if those people who are not fully qualified, 5 days course, 3 days course, there are a variety of courses available. You can do Reiki course in 3 days. What does it mean? Are you qualified? What degree of references have you done? What is the effectivity? What are the outcomes? What you need to do? What you should not do? Who is going to watch on you? Who is going to stop you doing in case you are not doing it right? Those things are not existing.
Yeah.
And the same thing is for many other therapies, which include currently, like Ayurveda is a fully established proper course in India, but not in UK. The regulation is missing. Same as homeopathy. So there are many countries like in Germany it exists. In UK it doesn't exist. So the regulation is missing. That means people cannot be penalized for doing it wrong. That again gives them a loose area to practice, and which can benefit or it can harm. Yeah,
absolutely. I always think it's really good to explore all the different options that are available on the table, providing they have the qualifications and the knowledge and the experience to back everything up.
One thing is interesting, that patient will try it anyway. If they're fed up. So if, for example, somebody is having chronic pain, which I give an example to my colleagues even, that chronic pain, you keep giving the medications like chronic pain. I had myself, like sciatica, and there was lumbar disc prolapse, and it was pressing on a nerve, causing a severe pain. Now, it's a nerve compression causing neuropathic pain. Now, I was admitted to hospital and I was wheelchair bound. And I didn't want to be wheelchair bound forever. I told my wife, I need to do something. I was taking morphine, Oromorph, which was prescribed to me. I was taking like pregabalin, which is a neuromodulator drug. I continued to take. I had, but then I didn't have enough relief. But more importantly, I didn't want to be drug dependent for the rest of my life.
Right.
So I went there. My wife was taking me in wheelchair to Sheffield to an acupuncturist. And I had acupuncture on myself. I had cupping therapy. I went to osteopathy. I went to massage therapist because something would work and there is no harm. I'm doing what is needed, but these all adjuncts, whatever, work, and I'm back to normal now, doing everything, working back, functioning doctor in a hospital.
So was it a combination of those things that worked, or you don't know what worked and what didn't?
Exactly, and the same thing is for patient. It doesn't matter what works. Yeah. So I stopped taking, slowly reduced, and I always recommend, there's a health warning. Always take the advice of your health practitioner. Do not stop the medication. Knowing knowledge, I slowly reduced it and then stopped it because I have managed to really do that functioning normally. I'm myself a yoga teacher, so I was doing yoga.
Yeah.
So which asana will do that? What pranayam, the breathing therapy, as many of people call prana, is the life or energy.
Yeah.
So you're breathing, the oxygen, the different breathing techniques give you a different type of energy. It stimulates your nerves, it stimulates your brain.
Yeah.
So all of these things happen, they're natural.
Yeah.
And now I have found that there are different neurotransmitters released. Some cause release of endorphins, some cause release of oxytocin, some cause release of noradrenaline. This is all like, if you think that there is in alternative therapies, whether yoga and other stuff, there is a sympathetic pathway and parasympathetic activation pathway. And these all may not have the same representation in the modern medicine, but there are similar things.
Yeah, absolutely. It's about being mindful about knowing what works for you, because what works for you doesn't necessarily work for the next patient, and what works for the next patient doesn't necessarily work for you. It's about actually listening to what is happening as you do X, Y, or Z, and actually listening, taking heed of what actually that feels like, what that's symbolic of, what are you noticing, how are you feeling, what are you aware of, what's changing, if anything. And it's about maneuvering that into a pathway that suits you. But there isn't a one-size-fits-all package. I don't think there ever is. I think it's just about understanding yourself.
You are right, and I commonly give that analogy to my patients or to anybody outside the NHS when I give the advice and talk. The people come to take advice that you have all the knowledge of modern medicine and Ayurveda and yoga and Tai Chi and Qigong. Tell me what I can do. I said that, look, I can give you the advice, but I need to know more. So it's all what they tell. You can make a tailor-made approach.
Exactly.
These are tools in the toolbox.
Exactly. And that's what I give to my clients too. I give them a toolbox. Some work better than others. That's why I ask them, well, what worked for you this week? What was good? What was not good? What worked? What didn't work? What helped? What didn't help? And then we tailor it so that they end up with a toolbox that works for them.
And same thing, so for example, like initial phase, I wasn't able to bend myself, so I can't do yoga at that stage. But then as gradually things improve, then that helps. So what works in one phase may not work in the other.
Yeah.
So it's good that you have that choice and then you can build on it.
Yeah.
And many of these, I've merged this now, physiotherapy with yoga therapy. because in modern medicine, physiotherapy is allowed.
Yeah.
Yoga is not. And therefore, when the physiotherapist came, she even came home because initially I was kind of almost wheelchair bound bedridden. So she would come home and she advised. Then I thought, if this happens, this as I mobilize myself, merge that to turn into that.
Yeah.
With yoga, you can move and do similar things, but with a better energy flow.
Yeah.
And you can do breathing to allow the energy to fill prana, and that actually vitalize your body tissue. And that is how, because
well, it helps with all the polyvagal theory and the vagus nerve and all of that connection to the central nervous system is the breathing, and the parasympathetic and sympathetic nervous systems is all connected.
Absolutely. And this is kind of connecting or bridging the gap between the brain science and the body science.
Yeah.
And that is where you differ, the clinical practice versus the alternative practice, because all of them have the same goal of improving the patient care.
Exactly.
It's coming from different angles. So if we try and bridge the gap, we will not only have the greater efficacy, but also a better feeling, because patient need to feel good. So the tissue need to heal, but also feeling needs to get better. And that's where the integrative healthcare or person-centered healthcare, as I call, comes.
Yeah. It's all fascinating stuff. It's all fascinating stuff. And we're working towards the same goal, and that's to heal the patient who is really struggling right now with overwhelm, burnout, anxiety, depression, loss, grief, stress, and a whole range of other physical and mental health problems.
So as you mentioned, for many of these, there is no cure.
Yeah.
And you are doing a miraculous job of trying to help healing these patients. Say, for example, for grief, there's no treatment. For phobia, there's no treatment in medicine.
Yeah.
For anxiety, you can give some anti-anxiety drugs, but is there any need for the drugs if it can be done naturally? And same is prevention. For as you do this, the emotional freedom technique, that's a simple technique, tapping. And with the tapping, if you can relieve the anxiety or prevent even before going to the anxiety provoking area, and you can do that, phobia, there is nothing like that, which is so good that we should bring it. It has got no side effect. Why not?
Yeah. People don't need to live with it.
Exactly. And same is again, and thanks for doing that talk on like eating disorders, anxiety, and anorexia. For anorexia, there is no medicine, but it's a disorder of thinking.
Yeah.
The image.
It's a belief system that's not true.
Absolutely. And there is no medicine for changing belief.
Yeah.
And hence, when it is something to do with belief or fear or thinking or processing, we should come to alternative therapies, including the hypnotherapy,
psychotherapy.
Yes. And energy therapy, etc. The trick is that many people have misused this energy therapy. There is some Teta rods, which one of lady has brought to me and saying that, look, you press this button, it sends the energy, and with that it will heal. And I thought, so there are all type of people around.
Yeah. Maybe they think placebo is part of all of this, though. And if placebo is part of this and they really truly believe that for themselves.
I mean, if that is the case, that's possible. But it might be better to take a glucose pill.
Yeah.
for like 20 pence or 10 pence.
Yeah.
The job than this tetra therapy or something, whatever the road was called. I don't know, it might work, God only knows, but very expensive treatment.
Yeah, absolutely. It is about getting to know yourself, though. I really do believe that it is about getting to understand yourself, what's important to you, what are your values, what do you believe? Are your beliefs in line with your values? Are they against your values? And the shift is massive if you can even see that your belief is X and your value is Y and they don't correspond. The shift by bringing them back online using psychotherapeutic techniques and EFT or mindfulness or neuro-linguistic programming is huge to witness, because they suddenly realize, hang on a minute, if I value that, why is my belief that? Or if my belief is that, why is this happening? And it's just about bringing that back on board online. And it's often from a narrative that is a past experience that's happened to them way back when they were 5 or 10, and the story is repeating. The narrative is the same, but they're looking through the eyes of a 5-year-old or through a 10-year-old. They're not looking through their eyes as they are now.
You are right. It's just one of those things. Sometimes I feel that, many of this could be a placebo or even externalization, because in your mind, you are just thinking the same thing, and you are kind of making a stronger belief on what is circulating around. And unless you cut open and let it out, continue to have the same thing. As people know fear of height. There's nothing medically wrong. They have a fear of height.
And it's probably caused from a really bad experience that they've had many, many years ago, and they've forgotten about it, or they don't know about it, or they're not aware of it.
And they believe it is going to happen. The moment they go, and then they start sweating, so physical symptoms do come. So we're not saying they're wrong.
Yeah.
It's just where it is coming from. And can we do something to address? And, there are like, interestingly, people have found that there is more release of GABA, which is a neurotransmitter agent, and glutamate. So these all inhibitory, excitatory balance are altered in these people. And that is a fact.
Yeah. You can't change facts.
You can't change the facts. But the problem is that they are suffering from it. And if we can do something to help changing that belief or what is happening, even everybody knows, people say, take a deep breath if you're anxious. There is a mechanism, the scientific mechanism. Taking a deep breath increase the oxygenation of the brain. You're taking deep breath, more oxygen going in there. It opens the circulation in a different way and release different neurotransmitters. As a result of which there is biological signature connected to the prefrontal cortex where all these things happen. And
how we think, how we plan, how we organize, problem solving, behavior, control, personality, all sits in that frontal space.
And it's interesting. One of the chapters I wrote in the book was neurobiology of intentions, and which is again probably hypnosis as well. So the effective intervention, particularly in chronic pain and the functional disorders, particularly psychosomatic disorders, is so important. Because there is tons of medications being used for it where there is no need. And even if we leave nothing else, even just 2 conditions, the chronic pain and psychosomatic disorders, if we just address this by the suggestion, hypnosis, or emotional freedom technique, all these, which are completely non side effect based therapies, even if 20-30% get relief, it's a big relief.
Yeah, absolutely. Any relief is better than no relief.
And it will reduce the burden on the NHS.
Absolutely.
It will reduce the burden on the family, because I see the family, suppose some child has these, the whole family is suffering.
Exactly.
Husband or partner, one of them have it. They can't go to a place, a mountain or anything like that because of this. So it's all these things which we can kind of down-regulate the sensory processing.
Yeah, absolutely. And it really helps if everybody is on the same page. So I'm really, really happy that we've had this conversation, because it makes it much more accessible for people to understand from a psychotherapist and a medical doctor who actually are on the same page.
You are right, and we need to have more of these conversations. And again, the course that we have kind of finalized now almost on Ayurveda is like, oh, Ayurveda and yoga can be used scientifically in a similar way.
Absolutely.
Same as like the hypnotherapy, the energy therapy, Reiki. My wife and I have been on one of the Reiki sessions, and we didn't manage to kind of go for a full hog of learning from a Reiki master. But my wife felt more effect and benefit than I did.
Yeah, but that's about getting to know you, your body, belief systems. Do you believe in it? Do you not believe in it? Am I willing to try anything to find relief? It's all connected to the same pathways of all I want to do is feel better. And that's all we're trying to do, is to help our patients, clients feel the best versions of themselves they can be, to live a normal, healthy and fulfilling life going forwards, instead of staying stuck in spaces that they didn't even know could be possible.
Yeah, and the other thing is also it depends on what state of mind you have at that time.
Yes, absolutely. It's what emotional state you're in that moment too, because some people manage emotions, have resilience to that. Some people's window of tolerance is higher, some people's window of tolerance is lower. What substitutes that, we don't know, but it's about it's muscles that need exercising and working, just like we exercise our body. We need to exercise what's going on in here, because if we don't, we get stuck. And we need to grow, because if we don't grow, we don't evolve, and if we don't evolve, we don't change, and if we don't change, we stay stuck. So it's about keeping moving. It's like riding a bicycle. If we stop, we fall off.
True, and there are many conditions where learning these things, and that's why I'm learning. A lot of people say, why are you spending hours and hours, years you have spent? You should have done private practice. You would have earned millions, which you have. The reason I'm doing is spending daytime I work in hospital, evening I spend on doing all this work and all this research, compiling it together, because I want to leave a legacy for future.
Absolutely. And we're in the same space, because I also want to leave a legacy for mental health. We need to change the way we're looking at it, because if we don't, nothing's going to change, and there's going to be more and more and more people suffering unnecessarily.
One example is simple, like gastroenterology, irritable bowel syndrome. Nothing like a cure. You can try and relieve symptoms a bit. But it's all we know that this is coming from the irritation of the bowel, and now there is brain-gut axis which they have identified. Absolutely. Gut has its own brain, which people used to say, this is my gut feeling. So normally feeling is here, but gut feeling is because of the gut brain.
Exactly.
And now it is scientific neuroenteric axis or neuroenteric system, which means enter is intestine, and neuroenteric system is intestinal neurological system.
Yeah.
And that is where there is hyperactivation resulting into the secretion of these neurohormones causing intestinal hurry, as a result of which they have kind of frequent visit to the toilet, tummy ache, and the tests are normal.
And it's exacerbated by stress.
And therefore, it's so important that for conditions like that, we can do something like yourself with hypnotherapy, coming down, yoga. I advise them. I see these, once diagnosis come, I've done the investigation, I tell them, now look, there's nothing definite medical therapy. You can have fiber, you can have this, which will help. But more importantly, you need to calm down your nervous system. And then I explain to them yoga, I explain to them pranayam, I explain to them a variety of different systems of breathing, because all these have effect on calming the mindfulness.
And calming the inflammation down through the nervous system.
So if there's more slowing down of the body systems and the nervous system has calmed down, it's not going to send impulse to the intestine to move faster. So your diarrhea will settle, your abdominal pain will settle, and you will feel much more symptomatically better, but also happy, because as a part of this yoga is also release of endorphins, the happy hormones, the neural network. And therefore you are in a win-win situation rather than lose-lose situation.
Yeah, absolutely.
Because when you are having this loose stool diarrhea, going to the office, you are anxious, and anxiety causes brain to release the...
Makes it, it's like a vicious circle.
So
and we have to break the cycle of the circle in order to heal what's actually going on internally. It was really interesting to connect and keep doing the amazing work that you're doing with the International Organisation of Integrated Health Professionals. I'm delighted to be part of your work and to help you in any way that I can. Thank you so much for coming and spending this time with me. It's been a pleasure.
Have a great evening. Thanks a lot, Jane. Bye.
Thank you so much.
Bye.
Bye.